Hello, my name is Megan. I'm one of the renal nurses who will support you in the renal weight management program should you wish to participate. I work with another lady, Helen. When you've finished watching this program, if you decide that it's something you wish to pursue, please contact either of us. The nursing role on this program that Helen and I will be taking care of will be to educate and support you on your weight loss journey. We'll be monitoring changes and symptoms that you may experience, including blood sugar level changes and blood pressure management. We will be in regular contact with you either by telephone or email. We'll liaise with your renal management doctor or your kidney doctor as required, and we'll help you to understand such things as behaviour change, setting goals that are realistic, and helping you stay motivated. Before you start this program, we will ask you to complete a readiness for change. This is useful in that it clarifies your level of engagement, whether you're ready for this change now or whether you're not quite in the right mindset at the moment, and it might be something you need to think about for a little longer, and then we can come back to it. How will we monitor your progress? The frequency of monitoring would depend on a number of things. It would depend on what level your kidneys were functioning at. It would depend if you were diabetic and which diabetic medications you take. It would depend if you were on weight loss medications and their possible side effects, and which reduced calorie diet you might be on. We would ask that while you're on this program, we would ask that you record your weight, your sugar levels if you're diabetic, your blood pressure, and any other issues that you have. We'd like you to then email those records or phone those results in to us on a weekly or fortnightly basis. In between, if there were issues that you had that you were concerned about, we would refer you to a traffic light set of instructions that we have that are meant as a set of guide rails to help you manage symptoms and things at home, and to know when to put your hand up and seek help from us. So on the right hand side of this slide, we talk about the side effects of a very low energy diet. So that's the OptiFast diet or the OptiSlim diet. And these are commonly reported symptoms in the first week or two of starting those diets. So bad breath is commonly reported, postural dizziness, so lightheadedness, going from sitting to standing, being irritable, having headaches, feeling cold, hair loss, and also nausea is very common. So let's start with blood pressure and talk about what it is. So it's explained by two numbers, and your kidneys are heavily involved in regulating your blood pressure. So the top number is the amount of pressure inside your arteries when your heart's contracting and squeezing blood out of the heart around the other vessels in your body. And the second number is the pressure inside your arteries when your heart's relaxed and refilling. Okay, we monitor it because we would expect some changes in your blood pressure when you start to lose weight. And that may mean that we need to change the antihypertensive medications or the blood pressure medications that you're taking. This next slide, understanding behaviour change. The definition of change is to make or become different. Changing our own behaviour can be very difficult as we are creatures of habit and we do things that bring us comfort. We behave in certain ways when we're tired, stressed, happy, unhappy, all sorts of things. And if we're wishing to change our behaviour, regarding our relationship with food or exercise, it will take behavioural change. The stages of change that we've listed here are this pre-contemplation, where you're not really thinking about it in particular, but it's in the back of your mind. Contemplation is when you're actively starting to think possibilities and what something might be like, and how that may be something that you're more interested in. Preparation, getting ready and making plans. So getting more engaged with the idea and thinking, yeah, I can do what you can do to make those changes. Action is giving it a try and seeing how you get on. Maintenance, so maintaining that new habit and perhaps tweaking it so that then you're able to maintain things or encourage yourself to remain on track. And relapses are quite common, and it's sort of a part of the whole process, in that if you may have a relapse but then getting back on that horse, as they say, and getting back into action, and not thinking that it's the end of the road when you do have a relapse. So what we'd like to do with our survey is to clarify which stage you are in, because that would give us an indication as to whether you're in the mindset for change now, or whether you just need a little bit more time to think about it, so that you can your motivation for change is clearer. So why change and what stops change? Identify for yourself why this change is important to you, and make that reason personal, and identify the importance of it to you. What barriers have you experienced when you've tried to make change in the past? So if you've had a few failures with change previously, identify what the barriers were to success. That will probably help. There are two kinds of setbacks that we have listed here. So a temporary setback, where you can, lose sight of your goal for a short period of time and then get back on track. And a total relapse, which is perhaps where negative self-talk prevents you from achieving your goal, and how you might address that, how we might work our way around that. So how to get back on track. Staying on track and getting back on track. Replace negative self-talk with positive self-talk. Surround yourself with supportive people. Doing it with somebody else is also very beneficial as well, having a support person to keep you both motivated. Ask yourself, am I sabotaging my own efforts, and why? What am I afraid of? Write down your thoughts. They're illuminating, usually, and seek psychological help and support if you need to. And above all, be kind to yourself and treat yourself the way you would treat a friend in need. So motivation. What motivates you? What's motivating you towards this program? Will be many and varied things, and individual to us all. I'd encourage you to think about that and give some clear thoughts to what you're trying to achieve, and knowing yourself the way that you do, how you can achieve that as well as possible. We're all very individual. The key to maintaining sustained weight loss will be motivation and figuring yourself out, and how to maintain your interest and motivation and ability to continue. What keeps us motivated, again, will be very individual as well. So being ready to make that change being important enough for you to change your usual habits. Feeling confident about how you will manage that will assist you as well. So some thinking about how you may motivate yourself and stay on track. Setting a SMARTY goal can help you maintain your motivation. Identifying the specific goal of what you're trying to do, make progress measurable. Think about how you can make this achievable, making it realistic so it's something you can do, and setting a time frame for you to achieve your goal. Adding things that are going to maintain your interest is also very important. So down to some action planning now. So with any changes that you want to make, a good idea is to start small. So a goal each week that you can then build on. It needs to be something that you want to do. It will make it more attractive to achieve, and something that you can do this week. So write down an action plan using that SMARTY guideline. So what would the activity be? Could be a walk after lunch 3 times a week and doing it for 10 minutes. And then you can ask yourself how confident you are to achieve that. So let's talk about feelings. Eating is a normal part of life, and we often eat depending on how we're feeling. It's quite normal to eat in response to feeling stressed, bored, angry. Sometimes we eat more to stay happy or to deal with stressful feelings, to soothe, distract or comfort ourselves. So ask, what kind of eater am I? What are the different reasons or triggers that we eat? And try to identify our own triggers. So we talk more about feelings on this slide. Emotions being a very normal part of being a human. Humans experience feelings about feelings, which I believe we are the only animal that does that. They do serve a purpose, and they're neither good nor bad. So avoiding or trying to get rid of feelings maintains them. It's how we respond to these feelings which is key. Learning to identify and managing our own feelings is very important. So mindfulness is this next slide. What's all the fuss? So what does mindfulness mean? It means paying attention in a particular way. So purposefully and in the present moment and without judgment, looking at things with curiosity and openness, observing. So moment by moment awareness of our thoughts, feelings, body sensations and surrounding environment. So rather than suppressing or avoiding our experiences, we turn inwards with openness and accept them. This allows us to process our experiences rather than avoid them. Practicing mindfulness allows us to start acting rather than reacting, enabling us to change habits by accepting our emotions, thoughts and ourselves. Now this slide is to help you learn how to perform mindfulness. So we talk about starting with easy scenarios where you're feeling good. So you're thinking about pleasant moments. Stopping, slowing down and breathing. Taking note, so observe your current experience with curiosity. What am I feeling? What am I thinking? How does my body feel? What is around me? What can I see or hear, smell, taste? And then open up to that. Turning inward and trying to accept your feelings. It is natural to want to fight, struggle, avoid and run away. And it's very natural when we become distressed. Remind yourself that everything will pass. Thoughts and feelings are not dangerous and they will pass. Try to name the different feelings: joy, sadness, tightness, negative thoughts. If you're having difficulty, ground yourself. Feel your feet on the ground, on the chair, touch something and just observe. Breathe and congratulate yourself. At this point of the presentation, we generally do a mindful eating exercise, eating a sultana. You can Google this exercise and try it. I'd encourage you to do so. It slows down the process of eating a sultana and appreciating the flavour, texture, the mouthfeel, the enjoyment of eating. When we eat on automatic pilot, we often consume more than we need to. So it can be a barrier to losing weight. Paying attention while you eat food can change the experience of eating. So I'd encourage you to look at that on Google. So what to think about now? We are here to support you on your weight loss journey. We understand that behaviour change can be difficult, and we're here to support you with that. Make your goal important, but start with small, achievable steps. Write weekly action plans to help you achieve that. Surround yourself with supportive people, your cheer squad, to keep you on track and motivated. We're part of that cheer squad. Setbacks and lapses are completely normal. So be kind to yourself, be mindful, be self-compassionate and positive. So are you ready to make a change? I would encourage you to make contact with Helen or myself, Megan. We will go through the Readiness for Change questionnaire with you over the telephone. We look forward to hearing from you and assist you on this weight loss journey. Thank you for watching this presentation.